What's going on, walk-ins? Welcome, family. We're glad to have another episode with you. I'm Nick. You got Michael. What's up, dude?
We are back again, and I'm excited because this is the last of our three-part series.
Our church series, as you like to call it.
Pastor series.
Yeah, I mean, that was the inspiration in the first part, but I haven't called it a church series. That was...
It is who we are, like you were saying.
You have to wonder, though, with all the doctors listening, do they even care about that kind of stuff?
No.
Yeah, it's okay, though. It doesn't matter.
Right, it's that hello.
That's right. With that being said, we are here to help you get more patients, deliver better care, get repeat visits, and help you scale your clinic. And we do that through this lovely podcast. And I'm glad to have you as a listener. I know Michael is too.
Yes.
Today we are going to finish up our series, Front Desk Marketing. This is going to maybe trickle outside of the front desk a little bit. It will still fall on the front desk, but the whole point today is just to put a big bow on what we've all talked about.
Yeah, and if you're like, what are we talking about this front desk marketing stuff? Like, so there's two other parts, a couple episodes back in between some interviews and stuff. And what we're trying to accomplish is like, we're hammering down on the idea of how important your front desk is. Mm-hmm. And wonderful. Like I was actually listening to the last episode the other day, and it was making me chuckle because we were talking about stress versus, all the different things.
High stress situations.
Yeah, the high stress situation stuff.
Which I got to admit, that turned out to be a pretty good episode.
Yeah. Well, let's just pat ourselves on the back. But all that being said, today, there you go. Today we are, like you said, we're putting everything in a big bow, going over some what seems like sometimes basic stuff, but I guarantee you, most of you aren't practicing this on a consistent level. And this is that nice reminder. Got to work that muscle a little bit on the customer service side, especially on the training, because people just tend to fall off and forget stuff.
Absolutely.
So let's just get right into it. The first part of this is the front desk is the face of the clinic.
It is.
It's a hard reminder, right? Because sometimes you naturally forget about that front desk person because, one, you see them probably every day and don't think about it. And two, you just assume things are okay because you're getting patients coming in, and typically if there's a review out there, it's more, if it's a negative review, it's about the doctor or the cost or something. But you kind of forget they are that first person that makes that first real impression on somebody, because the ad got an impression, the front building has an impression, but the first physical person is that front desk.
I want to make a quick story, or at least something that you had, I think you had shared it with me. Maybe it was Grace. I can't remember who shared it with me, but it was a TikTok video of a doctor. It looked like an urgent care that was retiring his front desk person.
That must have been Grace. I don't remember.
It may have been. Well, the doctor, you could tell really, Kimberly shared it with me.
Nice.
She was talking about rewarding. Anyway, the doctor had a really hard time with people liking him. There was a disconnect culturally with him. He was an Indian. So if you're one of our Indian listeners, this story, don't take it personal. Okay. But he talked about how there was a disconnect. I'll share this with you after. There was a disconnect with him, and that he was having a hard time just like connecting with people, and people didn't like him. And he hired this front desk person, and this front desk person essentially became family to him.
Okay.
Right. And she was retiring. And so the whole video is just this montage of how much this doctor cared about this older woman that had come in, believed in him, been the face of the company, treated his patients with respect, treated him with respect, bridged that gap, and their clinic grew and grew and grew, and just how he honored that person. And the reason I bring that up is because if this person is the face of your company, this front desk person is the face of your company, are you showing that honor to them? That they are literally representing you, the doctor, you, the clinic manager or owner? Are you showing them that level of care and respect that this doctor did for this woman?
Yeah, I mean, because it's pretty easily to just ignore it, right?
Right.
And just say, you're just the home. It's almost kind of, it's like the difference between the Publix worker and the Walmart worker.
Right.
Nothing against Walmart, but they're different. And like, there's reason why Publix wins on pleasure, is
it's a pleasure to shop here.
It's a pleasure to shop here. Customer service is always top tier with Publix, or you can say that with Chick-fil-A. It's because they focus on the people that face the customers every single day.
I wonder if Grace would agree with that.
That's true. She did work.
Connor loved it, man. We walked in there. It's funny. We're talking about Publix, which is a grocery store chain. My son worked there. He's 15. And we walked in there, and, man, they were just loving on him.
Yeah.
They're like, Connor, what's up? And I'm going, who is that? That's my manager. I'm like, you know how we feel about Connor anyway. He's awesome.
Yeah.
All right, let's keep going with this anyway. So proactive communication, segment 2 here, proactive communication for patient engagement. We want to educate our patients on our services. So what are the effective methods, essentially, of letting your patients know the full range of your services at your clinic? How are you communicating that through your front desk?
Yeah, because, I mean, obviously, you want the doctor to know the services well enough to offer them. We were even chatting with one of our urgent care clients, and he was complaining about how a couple of his doctors, nurse practitioners, whatever, didn't utilize everything at their disposal like they could have. And that, I mean, that's an internal thing. That's not front desk, but that's an internal thing of like, there's a great chance that your doctor, your nurse practitioner, they don't always ask for the upsell. And I know upsell is kind of a negative word in medical, but it's an opportunity to help the patient feel better or know about something. Same thing with the front desk. The front desk needs to have, like, obviously they're not going to sit there and ask about your medical stuff, but we all notice your front desk person influences your review request, right? And make the ask. They can also influence your additional services that you offer. I know a lot of our clinics offer weight loss or IV therapy, all these little add-ons, and just having like a little short card, right?
We have one that does like Botox
Yeah.
and
like,
microderm abrasion.
Well, and that's the thing too. And this is how I look at it. When you have a patient checking out, and that front desk person is probably involved with some of that checkout or the check-in, training them a little bit, say, hey, I'm glad you had a great experience today, blah, blah. By the way, did you know that we offer this now? Don't know if you have a need for it or if you know somebody that does, but just want to put this in front of you type of thing.
It's almost like a menu.
Yeah. Yeah. It's like a little short menu. I can almost imagine just a laminated piece of paper that has like a menu item and stuff. And then have a couple of printouts, say, oh, by the way, here's some more information if you want it. And they can hand it to them. Or even I even think about, why don't they ever do, like, we have a UCA conference coming up. Number one thing that all conferences do, they have little little plastic bags with a bunch of paper in it with different items.
Right.
Is there a packet that you can give your patients? Not only is like, here's the take-home packet for, these are the prescriptions that you're going to have. This is the whatever post-care type stuff. Also, by the way, we offer this, this, and this. I don't think there's anything wrong with that.
I mean, I got a packet from my dentist with a toothbrush and a little thing of toothpaste and some dental floss. And I'm like, y'all know I brush my teeth with toothpaste and I floss. Anyway, it also had a little marketing card in there of I think I had a coupon for a teeth whitening.
Yeah.
That was a coupon.
I think dentists do really well with
They do.
upsells.
Absolutely.
Because my daughter, she's 4. She goes to a pediatric dentist. Every single time she goes, we get a clear plastic bag with pediatric smiles, whatever, on the bag is a branded bag. Inside of it's a branded toothbrush, branded whatever. Everything we need. It's a travel bag, right? Everything we need if we have to go somewhere overnight. You know what? That lives in Addie's little backpack when we go overnight. We don't take her normal stuff. We take that little clear plastic bag.
I thought of a little cool marketing piece that your front desk person could hand out as well. That would also keep you top of mind. Of course, you would have to get it done and make it look nice, but it's a little fridge magnet. I get one with like the college football schedule from like every realtor I know. So I have 72 of them.
Thanks, Pete's Print.
Right, seriously. But anyway, I was thinking, one of the most popular TikToks that are made about urgent cares, and one of the most common things that you have to answer as an urgent care is, what is the difference between an urgent care and an ER? So what if you made like a 2-column refrigerator magnet at the top? It's got your brand and your phone number, or even a QR code to schedule online up at the top. And then on the left side, here's all the reasons you would use an urgent care. On the right side, here's why you need to go to an emergency room. There's no confusion here.
I got an even better one.
Okay.
Same idea, fridge magnet.
Sure.
I love fridge magnets. By the way.
Yeah, we got them on our fridge now.
Yeah. Boo on stainless steel, except for the new ones that can handle fridge magnets. Anyway, I mentioned this a long time ago in an episode, but it just came to my mind about the magnet part. So I had a client a long time. It was a pediatric or the pediatrician. On their website, because I had to build this, on their website, there was a dosage chart, recommended dosage chart.
Ooh, I like that.
Take that dosage chart and put it on a fridge magnet.
Yeah.
And
That's good.
I mean, as a parent, I don't want to. I know I can Google it and find out pretty quickly.
No, it's right there.
But it's right there at 2 a.m, and you don't know where your phone is anyway.
No, that's good.
Dosage chart, fridge magnet. Let's market that thing. But at the end of the day, is it helpful, right? Or is it going to actually be something they want to put on their fridge? Like the football schedule, we're in the South, we're in Birmingham, Alabama. Football schedules matter.
Relevant.
Roll Tide, War Eagle, it's a thing.
That's right.
And I'll say this too. We know that urgent cares are deep in their community. Instead of a college football one, maybe you do a high school football one or
That's
different.
Texas. All of our Texas listeners.
Yeah, right. Yeah, exactly. Or if you're up north, it's hockey. You know, whatever it is, like some type of localized sports schedule.
I think at the end of the day, the point is to take whatever that thing is and hand it to them as you check them out and let them go.
Yeah,
Or hand it to them on the way in if you're not going to see them again on the way out.
yeah, and that magnet might cost you $1.
Yeah,
But it's not about the magnet, though. It's about the person trained to give that out.
that's right.
Because
Which it is
the front desk.
the front desk person.
Yeah, because at the end of the day, you could have we know this, you could have a stack of these things, but if no one has been trained and like retrained on giving these things out every single time, it's kind of a waste. So
I'm going to glaze over this next part because I know that we talk about it all the time, and that's just soliciting reviews. I do want to make this one comment, though. I hope if you're going to the Urgent Care Association conference coming up at the end of March, beginning of April, that you'll come by our booth. We have a really cool thing that we're going to give away that's going to help you get more reviews at your front desk. It's going to make it super easy for your front desk person to just point at something and say, do that, right?
or even just have a sign that says
Yeah.
phone here.
Yeah, super easy to help you get more reviews. I think we've talked about it ad nauseum at this point. So just like you know that your front desk is supposed to get you reviews.
But
So,
I was going to say, but to add to that,
right.
more than a front desk can also hear the feedback from the patient on the fly.
Yeah, they cover it up. Don't leave us a review.
No, but like, so one, yeah, please leave a review. But two, when you're checking out, well, how was your visit today? Did you have a good? Did you get everything you need? Is there any questions on your prescriptions? Anything like that? Is there anything that I should go back to a doctor for?
Literally brings us to our next point. So you're right into it. Go.
Yeah, yeah. So it's the personal details, right?
Right.
This is something I learned a long time ago from just some sales training, customer service training, all the things. Use their first name. Dadgummit. Just use their name.
I do get called Mr. Horde,
Yeah.
to call back. You know what perks me up more than Mr. Horde? Hey, Nick, we're ready for you.
Come on back, Nick.
Nick? Horde? Nick? Nick?
How's Heather? I wish there was like I don't know, maybe there is. I've never like fully dove into a EMR system.
Salesforce does it. I know exactly where you're going with it.
But like,
I mean, you can tell their kids' birthdays and what their flaws are.
Can you have like a personal? Can you have like a personal notes section when they pull up the patient doc? Hey, and you just kind of get to know them a little bit more.
This is crazy, but they should build this into the EMR softwares, but it's not there. But going back to Salesforce, I was watching some kind of a little brief demo on it. They now have AI where it says you should ask them about this the next time you call them because it scraped their social media, and it's like, it's insane. Anyway, that's creepy.
Can't do that in the HIPAA world,
Yeah,
but
still,
I guess not. I don't know. But at the same time, like having those, because I'm not gonna lie, it becomes frustrating when you go in and you have like 3 people ask you the same question over and over again, and I know it's not true. They act like they never met you before. So that's the thing. But like the other day, I had to go to a doctor, and like I was going through like, yeah, this is why I'm here, blah 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 blah. When the doctor came in, he's like, I see you got this, and this. I think this is what we want to do. Are we on the same page? Yeah, we're great. I love that. Like it was, I see what your problem is. Here's what I want to do. I just need you to say you're on the same page with me. And that,
if y'all ever schedule a discovery call with my team, you'll probably meet with Grace or Nicole, most likely Grace.
Yeah.
And it's funny you say that because she'll gather, and she's like a nurse. She'll get all the information.
she's triaging you right
She
now.
is. She's getting all the information to make sure that you have what you need. I have what I need. She puts that information into a system for me. And when I hop onto a strategy session with you about your clinic, I know exactly what your problem is. I know exactly what I need to do. I've formulated a strategy before I walked into that call.
Yeah, they're
And we're
not
just-
sitting there repeating themselves what
Yeah.
they just told Grace a week ago.
Yeah, exactly. It's not a repeat. It's a strategy session. Anyway, I bring that up because imagine if for just a second, all of that information was brought back up by your front desk and then they had that visit already pulled up. Anyway,
Yeah.
let's keep going.
Yeah, I mean, because the and granted, that's the biggest challenge I think urgent cares have because they don't have an opportunity to build a relationship with patients very often because it
It could
takes
be a challenge.
because a patient doesn't come back just for wellness visits, right? They just come back because they don't feel good. But if there's an opportunity, because it would be so cool to me if I go back to the urgent care that I went to a few weeks ago and they said, hey, in our notes we show you had that, and that. Has that been cleared up for you? Is there anything we should discuss on that? Like, just makes me feel better.
So a little bonus content before we get to this next thing is we did a podcast episode. I can't remember the name of it, but was always book a meeting from a meeting, right? So always book a appointment from an appointment. If they're leaving and they're sick, like a key thing for your doctor is to say, hey, I want to see you back here in 2 weeks. There's another copay for you. There's another insurance hit for them. It's real value for you to stay on top of their health care.
Yeah, there's an extra review opportunity.
That's right.
Like I even have like an appointment coming up, and they went ahead and scheduled my post appointment for it.
Right.
So I now have 2 appointments in a week with them. It's already pre-scheduled, and that's important too because at the end of the day, great example. Next Tuesday, I'll have to reschedule it because I saw it in my calendar and I forgot about it. But next Tuesday would be my annual follow-up with my primary care that I set a year ago.
Right.
And
It's already set.
It's already set. Now I'm going to have to adjust it because of other things, but I'm going to reschedule. I'm not going to cancel it. I'm just going to reschedule it.
Sure.
And that's a huge thing because if they didn't ask me a year ago, it would not be on my radar.
Right.
At all. Just not at all.
Well, one of the things that we want to talk about is communicating follow-up messages and checking up on your patient. That is a form of marketing. I've told the story before where, I had COVID one time and that's back when they were just swabbing you in your car. Don't even get out. Don't come near me. Don't even breathe near me. And I'll never forget the doctor, just shooting me a text about a day later. I think, hey, you felt super bad. I hope you're doing well. Is there anything that you need? Did you get your meds? Are you okay? Now, I don't expect every doctor to do that, but you can train your front desk to make a note by the people who need to be followed up with that day or whenever. And they can use your system to shoot out a quick text message. Hey, Dr. So-and-so just wanted me to send you a quick follow-up. Did you get what you needed? Were you able to get your medication?
Yeah.
That just shows that you freaking care.
Like I could see it because I had an operation last year. I was like, oh, it's been a year. Last year, and there was a follow-up nurse that called me a day later.
Right.
And he literally just went through those questions. Did you get this? Did you get that? How do you feel? And in my head, so obviously, staffing is a thing, right? There's some limitations around it. But I look at it just like a salesperson, where the salesperson makes the fortune in the follow-up. And we all know that you're way more effective when you have every morning, let's say at 8:30 or 9:30 in the morning, from 9:30 to 9:45, or maybe it's before you open, who knows? You have every single person that you need to do a follow-up call to.
Right.
And the goal is not to just sit there on the phone with those people for a long time. It's more of, I need to call every single one of these before we open or within this 30-minute time slot. It may take you time to figure out how many you can handle.
Right.
But then all of a sudden, you've made touches to like 10, 15, 20 patients that it's the extra mile, right? Because like they've been taken care of at this point, but now you're just following up with them. And you may get voicemail every single time, but you've made the effort. And when you say, hey, this is Michael at so-and-so urgent care, I was just following up with you. You guys came in on this date. I want to make sure everything was fine. If you had any questions or any issues, please give us a call back at this number.
You could even automate, by the way, a voicemail drop.
Yeah.
Right. And it's not as personal, but it still sounds better. And what a voicemail drop is just simply somebody records a generic-ish
Hey,
voicemail.
this is Michael from Urgent Care Bob. I just want to follow up with you.
This is Nick from Nick's Urgent Care.
Yeah.
I know you came in recently. I just want to make sure that you got everything that you need. Did you get your meds? Did you have a follow-up plan? If you have any questions, give us a call back. Here's our phone number. Would love to walk through that with you. I never mentioned the person's name. I never mentioned their ailment. None of that. It was just a voicemail drop. They can go right into their voicemail.
It doesn't even ring their phone.
Yeah, it just goes. There's no way for them to even pick up. It goes straight into their voicemail. So, gotta love technology. All right, so Section 4 is a little interesting. This would be for somebody who is like a dentist or a chiropractor or your urgent care clinic. Maybe you offer some ancillary services like Botox or weight loss or anything like that. This isn't going to be for your typical I'm sick, right? And this is kind of a loyalty program. All right.
Yeah.
So, if your front desk person is able to say, hey, listen, refer somebody to us, do this, do that. Having some kind of a loyalty program in place is going to be very good marketing for you.
Yeah.
Okay. And it could look something like, hey, hand this coupon to one of your friends and we'll just put a credit on your account.
Yeah. Oh yeah.
Right.
It's just, and I know people are listening. That seems hokey. No, it actually, there's a reason why they've been existing forever now. Loyalty programs is one of the, and I agree. I think it's way more effective on your ancillary service and not your primary.
It's not your primary care.
Yeah, not your primary care, urgent care situation. I agree. Get your fourth vaccine free. I feel like there's a contradiction there.
Sponsored by Pfizer.
Oh Lord,
Moderna.
You got the Moderna effect. There you go. Anyway, hello. So I agree. Like,
why is our fourth vaccinated client cross-eyed? I don't understand.
That was the free upgrade.
They have a third eye. We don't know where that came from. Anyway, all right, I'm done with the jokes.
So people listen 20 minutes in. Sorry,
you made it this far.
Yeah, right.
You haven't swerved off the road.
No, not at all.
Anyway, there is a place for loyalty programs. It's going to follow along the lines of Botox. It's going to follow along the lines of weight loss. IV therapy.
IV therapy would be a great one.
IV therapy is a good one. So these are the kind of things where you want to have a loyalty program in place. And that looks a lot like frequency of visits or referral program.
Yeah.
Right. So it's going to be one of the two. It's a really quick Google search. What is a good loyalty program? What is a good referral program for medical? Insert the medical thing,
or even a slightly adjust to that. If you're doing giveaways for reviews and stuff like that, that's less of a loyalty program, more an incentive program. Mm-hmm. But at the end of the day, this society is completely trained by perks.
Right.
We want perks. Like you and I were talking about a couple of weeks ago about utilizing restaurant apps. And then you joke, you're like, yeah, I'm paying for your discount because I don't use the app.
Right.
But it's a real thing. Like, I'm 35 years old. I know if I frequent Jimmy John's, if I do it often enough, I get points, I get free whatever. I realize I'm spending money, but I was going to spend it anyway.
Freaky fast healthcare.
Freaky fast healthcare. Well, I mean, what's the gas station that has the urgent care? Quick Trip.
No.
Quick Trip. Yeah.
Like at this point, are you kidding?
Yeah. So if Quick Trip can have an urgent care, I think Jimmy John's could have a.
That's called Quick Care or something like that, isn't it?
Yeah. I have to go look it up.
We should get them on the podcast.
Yeah, we've tried.
Yeah.
And they won't listen to us. Anyway, freaky fast urgent care.
All right, next one. Okay. Participating in community events. I'll tell you this, just about every city ever has a chamber of commerce.
Yeah.
Having your front desk person just go there and hand out cards to people, just the fact that you're participating in the community, that's going to go a long way. We have another friend of the podcast. It's an American Family Care franchise conglomerate. They go out and they sponsor like kids track and fields and kids, what do they call them? Field days?
Yeah.
They go out and sponsor those by providing T-shirts or water bottles. That kind of community engagement, yes, it can be done by the doctor, but it's going to be really good if you do it with the face of the company.
Yeah, it really, because at the end of the day, especially when they have their out, make sure they're uniformed up, right? Like, so they recognize who you are to a certain degree, but maybe not a white coat. You don't need a white coat,
right?
But yeah, when you're because I've done the chamber thing for years, and a lot of chambers also have health days, and so health days are fantastic. And what are health days? Typically, they're focused chamber events where it's it's the luncheon time frame, but it's focused around healthcare or whatever. One of the biggest things, like we're here in Shelby County. Shelby County Chamber has like a healthcare professional of the year. Those things are super helpful because one, you can start to advertise off of that. Hey, I got healthcare professional of the year, all the different things. And also, a lot of people don't realize in the chamber world, ribbon cuttings don't mean you have to be a brand new business. You can have ribbon cut anytime in your business. And people forget about that.
I didn't know that.
Yeah, they don't care. It's just free advertising and food. So
It's a matter of just being a part of the community
Yeah.
at the end of the day.
Yeah.
I know we were a part of BNI for a while.
Yeah.
I'm not saying that I recommend this, but I'm saying check it out. If you have, like, for example, a lot of dentists close on Friday, right? If there's a BNI on Friday and you can go visit that in the morning, BNI is Business Networking International, by the way. Not trying to pimp that on you, but that's a place where you can go and network with like-minded business owners that want to refer you, right?
I mean, at the end of the day, what we're trying to say is get outside your office.
Yeah, get out of those 4, 5, 6 walls.
Yeah, get out of the walls. Go visit. Go. You're part of the community. People want to meet you. You may think they don't want to meet you. They want to meet you.
They want to meet you. They want you to be a part of their community.
Yeah, and they're always going to remember you when you make it feel personal.
All right, last one is going to be social media, online presence, and email newsletters. Chances are you may have some dedicated marketing person or an agency already doing this for you. And if you do, great, let them do it.
Yeah.
But there is nobody as dialed in to your urgent care or your clinic as your front desk person. Nobody, not even you.
Right.
Okay, your front desk person knows what's going on in that clinic. They know who's out sick. They know who's coming in and visiting. They know the drama behind billing. They know all the things that are going on in there. They also know the culture and the pulse of your clinic.
Yep.
And that's the kind of stuff that no agency, I don't care who they are, can promote on social media better than somebody who's dialed in on a daily basis at your clinic. They understand that Peggy Sue over here is pregnant and y'all are celebrating that. And what a great time to take a picture of all of y'all and post that on social media. That is gold.
Yeah.
Making sure that this sounds stupid, but this is still the best performing social media post we've ever done as an agency is match the person to the dog.
Yeah.
Just the kind of stuff that is inside cultural here's what you're doing. Here's what you're doing. You're inviting the community into your world. You're inviting them into your world when you post more personal things on your social media profiles.
Yep.
Right. And then newsletters, Michael, if you want to take a stab at that real quick, I've got some thoughts, but
On like email newsletters.
yeah,
and stuff?
just the ideas for engaging patients through email.
Yeah, I mean, at the end of the day, email still works. Email is cheap, and email volume matters. Like a lot of people, I send a newsletter once a quarter. People aren't going to really look at that because they don't really know what it even is anymore. So you have to think about that. So inside your email newsletter, how often should you send out a newsletter? Some do daily, some do weekly, some do monthly. I would lean toward the weekly. I think that would be pretty effective. But at the same time, you have to have good content in there. And the content itself, so what we know is like it's good to put in content that has an action tied to it, where it's like it talks about something, but it wants you to go to the website or go to your Facebook to go look at it more. Because if it dies in the email, it doesn't do as much for you, right? And you need to get them to leave that email to go somewhere. It's the starting point. And you have to think about that because there's been a lot of, I'm sure you've all gotten email. Here's the thing. I'm sure you've all gotten lots of email newsletters in your lifetime and you probably scanned it. That was pretty interesting. And you moved on. Well, from that company standpoint, it didn't do anything. So
You're right.
Because you didn't take an action. You're like, that's because I bet it's pretty rare that you read that email newsletter or whatever. And you're like, I need to go look this up and go find what they're talking about. If you have to make that effort, you've already given up. Like it's not going to work. But if you give them an option to get to it, engage with it. I mean, the best ones, one of my favorite ones is Wise. We're big Wise fans here.
Yes, we are.
The WYZE camera company. They send out a ton of newsletters. And they have lots of call to actions to get you to purchase some new product. Or they're very honest in their communication, too. That's the other thing, too.
We done messed up.
Yeah, they have.
It happens.
It does. But they admitted to it, and that's a lesson to be learned.
And owned it.
Yeah, it's better to own it than ignore it.
I got one the other day from AT&T. Hey, we had a big outage. We
Yeah, you
messed
did.
up. There's a credit going on your bill.
Here's your $5.
That's how we're starting. I don't know what it was, but so when should you send out an email to everybody that you have on your email list? Did you add a new online scheduler? You should tell them about it. Did you hire a new doctor? You should tell them about it. Is there a change in something that you're offering at your clinic? You should tell them about it. Do you have anything at all of any kind of relevance to say that would make an impact on them? You should tell them about it.
Did you sponsor an event? You should tell
them about it.
Did you have a
You should tell them about it.
I was like, what's happening?
You should tell them about it.
Yeah. Well, and then what's going on in your employee in the coworkers' life? Tell them about it. Right? Because at the end of the day, there's a lot of people say, I don't have anything to talk about. You do. You're just afraid to say it. At the end of the day,
did you get a 5-star review?
Tell them about it.
That's right.
I mean, because at the end, that's something I think we all tend to forget is we know a whole lot about something.
Yeah.
And if a patient or a customer or a client comes in, they don't know enough and they need you to tell them what to do or whatever. So which means you have a lot of knowledge that you can talk about and spread about. And if there's 5 to 10 people in your clinic, there's 5 to 10 opportunities that something new has come up. Every single time.
We just rolled out a new policy here at our company, Patient Care Marketing Pros, where everybody is responsible for content. Everybody. We should do a whole episode on that at another time, but everybody is responsible for having some kind of content knowledge that we can share with people that we know.
Yep.
That's a lot to unpack. We have had 3 episodes of front desk marketing, and it's really a challenge to put all of this into practice. So I don't want to tell you to take all 3 of these episodes and put every one of these things into practice.
We should have a front desk quiz.
We should. But what is the one thing that if you implemented it into your clinic, it would make your clinic better? You pick it. You decide. Is it having a strategy for loyalty? Is it making sure that there's accountability to asking for reviews? Is it being more present in the community through chambers of commerce, through sponsoring local, schools, through whatever for that? Is it getting your doctors, or at least having a plan in place to respond to your patients after they leave just to check on their care?
Is it freaky fast care?
Is it freaky fast urgent care? Right. So I'm asking you that because I don't want you to get overwhelmed. What is one thing that you can add without, having your front desk person quit? Because we already know how busy they are.
Yep.
But what is one thing that they can do that would help them be a better face for your business and help your business grow, help your clinic grow? I want you to think about that, and I want you to put it into practice.
Yeah. And also, if you're like, hey, we check every box you guys talked about, send us an email.
Yeah.
I want to hear, you're going to come on the podcast and you're going to tell us all these wonderful things that you guys do and what works and what doesn't work, because we love that type of feedback. But going back, you're saying implementing one thing. So there's a book out there called Atomic Habits.
Love it.
Is it James?
James Clear.
James Clear.
You got it. You're right on point.
And he is a 1%er, right? Mm-hmm. So the idea behind it is that focus on that 1% improvement, and over time, that 1% becomes 100%. Mm-hmm. Just give it enough time and effort. But at the end of the day, if you're doing one, and this is what we all know here, there are things in your clinic here in our office here, there are standards. At some point, they weren't standards. They were improvements, but then they became a standard, and we can't look back, right? That's not why would we ever do that? That type of mindset.
Every policy was birthed out of a problem.
Yeah, right. And so
every one of them.
But now it's let's keep anchor. There is no company, Apple included, there's no company out there that says we're perfect. There's no reason to improve. There's a reason why there's a new iPhone every single year. 1, to make money, but 2, they've made improvements to a standard.
And also to make money. And let me just be clear about this. If you're in urgent care, you're in this to make money.
Yeah.
If you weren't, you'd be working at a hospital, you'd be a physician, and
like a nonprofit situation.
You're in retail medical. You are in retail healthcare. It's your responsibility to make money and to turn a profit. Yep. Otherwise, you won't be there. Your team won't have jobs, and you won't be making the impact that every one of you know that you need to make in your community.
Yep. And on that note, thank you guys for listening in. And I hope if you like this series, if you like this idea of a series, let us know. We're experimenting. If we get some positive feedback, you may hear another series come out of us soon.
Absolutely. Y'all have a great week. We'll see you next time.
See ya.